What are the deficiencies or the disorder you see nowadays in IT employees? Okay, we see a lot of heart attacks are coming up and all those things. Can you give more light on that?
So I think the number one disorder we usually see is more of a mental sort of a stress or mentally induced. Some people we see with depression, some people we see with anxiety. Most of it is all stress induced. So if you keep the mind part of it aside, if I come to the body part of it, then it is a list of things actually. And most of these patients or most of these people, I wouldn't even call them patients because they're otherwise normal. These people come with a variety of symptoms. And one of the most common ones is I feel tired, I feel drained all day, I feel like I'm not able to even get up from my chair and go for a short walk. If I take say 2 floors, I try to climb up, I run short of breath. So they sound like very big problems for especially younger people who are in their say late 20s, early 30s, sometimes early into their 40s. So these age groups are actually supposed to be one of the healthiest sector of the society. And when we see these patients complain, then it raises questions. So what I have discovered, of course I practice hematology and blood and blood disorders, but we see that a lot of these patients have multiple nutritional deficiencies. So because of stress or anxiety or because of their work pressure, they're not able to cook at home and they're not able to consume the right nutritious kind of food. They depend on outside sources for most of their meals, and a lot of them end up being nutritionally deficient. So we see a lot of vitamin B12 deficiencies, we see a lot of vitamin D deficiencies because most of these patients don't want to step out of their house or they're not able to because of lack of time. We also see iron deficiency, we see micronutrition deficiencies, a lot of hair falls. The rate of obesity or the rate of overweight and obese people has definitely been on the rise because one, they're not eating nutritious food. Second thing, they're lacking in physical activity or movement because they're fixed to their screens, and stress or anxiety causes them to eat a lot more than what is required. So all these little things add up. Although they seem little, they are the basic building blocks for building a healthy body and a healthy mind. So having the right kind of nutrition by consuming enough protein, enough vitamins in your food is very, very vital. And of course, including the right kind of mineral containing foods is very important. So what I try to encourage most of my patients is, or people who come with these problems, is at least go for a regular health checkup. Make sure you get a basic set of blood tests done on a regular basis so you know where your body is. And even if it is small steps, you can take the first step at from your end and try to work one step at a time, one day at a time, and try to fix your nutritional habits, your movement habits, your physical activity habits, so that you are not facing a wall. Say, if you're facing a small brick wall, you can definitely jump over it. But if you let your problems stack up and you don't address it when they are small, then it is going to stand up in front of you like a wall that you cannot climb over. So paying attention to your symptoms, paying attention to your body, being aware of your body's general being and symptoms, at the same time meeting the right specialist and getting the right either blood tests done or scans done, and focusing on the right things in life is extremely important.